General Physician PC continues to grow by the day, and today we would like to introduce you to the newest addition to the practice, Lancaster Medical. Now joining us this morning is Dr. Kevin Cleary. Doctor, how you doing today?
Great, wonderful.
It is so good to see you, and more and more doctors are opting to join larger medical groups. Why do you think that is exactly?
Well, I think because of the growing complexity of healthcare today and the increased rules and regulations at both the state and federal level, it's hard as a private practitioner to stay out on your own nowadays.
And with these types of mergers, how does that affect the patients? What feedback have you received from them?
Well, I think it's going to be a great benefit to the patient because I now can provide them with a lot of ancillary services and support that I wasn't able to do on my own with a smaller practice.
We're in the summertime season. What are some tips that you can give to our viewers so they stay healthy during this time of year? Because let's be real, no one wants to be sick.
Right. Well, basic things like getting plenty of sleep, eating a healthy diet, exercising, sunscreen and sun avoidance to avoid the increased risk for skin cancer. And summer is also a great time for preventative care, getting those college kids and those school-age kids in for their physical exams and their preventative care over the summer.
Now, when folks come and visit you, there has been a lot of talk about the recent measles outbreak in the U.S. I'm sure many of your patients are very concerned. Should they be concerned, and what are you telling them?
If they've had their vaccinations, they don't have to be concerned. Okay. The increased number are due to people that aren't getting vaccinated. So when my patients call, we check their vaccination records. If they've had their immunizations, they're good. If they're not sure, we don't have the records, we can do a simple blood test to make sure that they're immune. If we test them and they're not, we recommend they come in for a vaccine.
Okay. And where are you located exactly for our viewers at home?
4893 Transit Road in Lancaster.
And what is the best way to contact you?
Usually through our phone, and then now General Physicians PC is going to have contacts both online and through their answering service.
Wonderful. And as General Physician PC continues to grow, so does navigating the healthcare system. It can be quite complex. People still want that one-on-one time with their doctor. They want to be able to sit down and speak with him and her about the issues or what they're experiencing. They always like that touch of a small practice. So as we continue to grow, how are you maintaining that and helping them become more comfortable?
Well, one of the things General Physicians PC has done is they've created a platform where we get the benefits of economy of size, but at the same token, that doctor-patient relationship, that personal interaction has really been maintained at all the individual offices.
Wonderful. And how does that make you feel as a doctor here at this place?
It feels great because I've been in practice for over 20 years, and these patients want to maintain that bond with me that we've created all these years.
As you mentioned, you've been working in the field for quite some time now, and you have had plenty of experiences. So what would you say is the biggest challenge that you're seeing right now in the medical field?
I think the biggest challenge for physicians today is the platform for healthcare delivery has changed. And trying to keep up with that, the technology and the costs has been very difficult for patients. EMR in the office, EHR in the hospitals, telemedicine, portals, and trying to keep up with the technology and afford that technology has been tough.
And you're right, there's a lot of changes when it comes to services and technology. By the minute, this industry continues to grow, but change comes excitement, right? What are you most excited about the future?
Well, the very platform that's made it more difficult for us as physicians to survive on our own is actually very exciting for the patients. My patients today are more informed, more involved in their healthcare, and better educated than they've ever been. And when they come in to see me, they've already reviewed their own labs, they've checked their x-rays, they've done some homework on their healthcare conditions. And instead of me telling them what to do, it's my patients and I working together to find a path to healthier living.
Sounds like a pretty exciting future ahead for all of us.
Very much, yes.
Oh, well, it has been such a pleasure to meet you,
Yes,
Dr. Kevin Cleary, everybody. I guess all we got to say is now, welcome to the team and congratulations.
Thank you. We're very excited.